Hello, I'm Dr. Afra Turner. I'm a student counselling practitioner at King's College London.
Hi there, and I'm Dr. Emma Broglia. I'm a lecturer in the School of Psychology at the University of Sheffield.
So welcome, we're here to talk today about forming and developing a practice research network in student mental health. The practice research network is called Student Counselling Outcomes Research and Evaluation, and the acronym is SCORE.
So Afra, tell me about the SCORE network. What is it and what was the main motivation for starting it?
Okay, so the SCORE consortium or network is a practice research network bringing practitioners, service leads, academic researchers and professional bodies such as the BACP, the UKCP, and more recently UMAN, which is the University Mental Health Advisors Network, which is also included in a lot of university and mental health counselling services. So essentially we've come together to collect data that comes directly from routine practice in the counselling and mental health services to understand student mental health better.
So in terms of data, you're talking about, what are you talking about?
So what I'm talking about is routine practice in most university counselling services would be an intervention of counselling or guided self-help or elements of a counselling intervention where a measure is used. So in psychological services there are validated measures which essentially a student completes, and it shows their experience of the intervention that they've received.
Okay, so in terms of best practice then, what's the advice about using these measures?
Well, all practitioners in healthcare professions such as the NHS are supposed to, for best practice and ethical practice, which is important, to use measures in order to ensure that they have improvement outcomes, or can at least record what's going on with the intervention and look at why there is an improvement if there isn't.
Okay, so the measures are used in practice?
Yes.
To facilitate conversation, maybe, to have a look at progress, anything else?
They also are used to pull the data so that you can look at the outcomes of the service, so not just individual clinicians and their particular clients, but to look at how the service is meeting the demands of their population. So for universities, the student population, if you were seeing staff, it could also be for the staff population, but it's a way of looking at how the interventions are being experienced by the user.
Okay. So is it safe to say you're essentially trying to see what works?
Yes.
Okay. And bringing this back to the SCORE consortium then, what are some of the things that you've done so far in SCORE?
So in SCORE, what we are really trying to do is to encourage services and practitioners to implement routine outcome measures, because often services, often because of resourcing or lack of training, haven't had these systems in place, which the NHS have had from often from design of their services. In university counselling services, often been a more of a reactive service development, so responding to student need, the rising complexity and risk, and the resources go there, whereas SCORE's momentum is in there being an attempt to implement routine outcome measures session by session in order to validate the work that's going on in services, and to be able to look at where things need to improve or interventions need to differ.
Okay. You said a really interesting word there. You said validate, like validate interventions, and there's a really interesting piece of research that was led by Michael Priestley, who I worked with on this paper, and we essentially spoke to students and asked what do they want to know if they're thinking about seeking help from their university support services. What do they want to know? And I mean, there's many things that they want to know, but I was quite surprised but also impressed that students seem to want to know whether these interventions work, whether there's an evidence base there, whether they are validated. Is this something that comes through that you see in services as well, in terms of practitioners using measures?
Well, yeah, I mean, myself personally, I am a practitioner, and I think the measures are a great way to work with the client, the student, and show them the journey of the intervention, of the time that you've spent together on a graph, and for it to be depicted in that way, and for it to be based on a universal measure that others use, not just within the student counselling population, but in the NHS and in the voluntary sector and charity sectors. So yes, I think it really works. It really helps the practitioner to have a frame, and another a sort of pictorial narrative with the student. Given that there has been, over my career of 30 years in university counselling service, a huge increase in demand, complexity and risk, I think for ethical reasons, we have a duty of care really to show that what we are offering works. So this is one way. I mean, obviously there are other ways as well. There's qualitative data, there's feedback, there's focus groups with students, but I think it is an important way of measuring the outcomes of a service.
And in your service, you use session measures every session?
I do. Not all of the counsellors are yet doing it session by session. I think for the University Mental Health Charter that we have actually been accredited with, it is going towards session by session, because then you get a full data set, which you don't if you're just doing it at the beginning of the session and at the end, because obviously at the end a student might not turn up and then you've lost your data. So it ensures that you have good quality data, which is what King's is modelling.
It's really interesting you say that, because that's certainly the practice that we have here at Sheffield as well. But also in terms of some of the data that we've been able to have a look at in terms of the services that are contributing data to SCORE, that are using those measures every session. When we've analysed the data, comparing services that use measures every session, and by that it means we have data on all students, all clients, so whether they have an unplanned ending or a planned ending, we know what happened to them at the point at which they stopped turning up, whether that's a good thing or a bad thing. And we've been able to compare outcomes from services or from students that have planned endings versus those that have unplanned endings. And it's probably not a surprise, you're a practitioner, in terms of what the research from SCORE and wider research has told us, is that students that have planned endings have better outcomes from therapy and counselling and mental health services than those that have unplanned endings. Now, some people might say, well, that's obvious, because maybe they didn't get on with therapy, maybe they dropped out. But I don't think it's always a bad story either. Sometimes students stop going to therapy because they feel okay. So I think one of the things that's really surprised me with the data that's come from SCORE is seeing that comparison between the students that have quite complete data, they're regularly turning up. Because you're using measures all the time, you don't need to know if a student's going to come back or not, because you always know what's going to happen to them. And you can have a look at the most recent sort of data point and the most recent information and have a think about, okay, well, was that a one-off, or is there a pattern emerging in terms of the students that are sort of dropping out? Why are those students dropping out? Are there things that can be done to maybe prevent that or look into that? Is this something that you've looked at in SCORE or in your service?
I think practitioners tend to be a little bit wary of analysing the data. I think I know from SCORE, both yourself and Professor Michael Barkham are guiding our learning in doing so. If I'm honest, I think that question is probably a question that most practitioners would struggle to answer. And the good thing is that by using the measures and beginning to collect the data, both within just your own caseload, but then a service caseload and then a sector-wide caseload, you begin to learn these things that are important and can improve the way you offer your counselling and mental health interventions and groups or whatever you're providing in the services. But when you asked that question, my initial response was, oh, I don't know how many people that I know of would be able to answer that. But I think we're on a journey, and I think that's SCORE's mission. The reason that SCORE came about was because not only myself but other practitioners were aware of the increasing demand, complexity and risk, and also the sort of responsibility to show our stakeholders that what we were doing did work, even if we knew that actually students and staff in the university may not know. So it was a way of engaging in a narrative that was understood universally. But it's a slow trajectory.
So you've talked a bit about the origins and the motivation and the trajectory, and you've alluded to some of the things that might be coming in the future. What are some of the priorities for SCORE in terms of the next thing that we're going to do?
Well, I think SCORE is still very much focused on encouraging services and practitioners within services and service leads really to, you know, integrate and implement routine outcome measures as standard practice, so that we can share the data universally across the UK and find out what trends are happening in student mental health and ensure that we're meeting our student needs with the best interventions possible, or anything else that perhaps comes out of that. So you know, that's what they do in the NHS, that's what they do in other sectors. Why wouldn't we do it in university counselling services?
That sounds very ambitious and very important as well. I'm sure there might be some people thinking that that's quite a big thing to take on. Where would you start? So in terms of what you've learned about what works of SCORE, what one piece of advice would you say, if someone's sort of getting to grips with this for the first time, it can seem really overwhelming, what's the one thing you would advise them to do?
Well, reach out to SCORE would be one, because we are working currently on a training package. It's difficult because we are all volunteers in the SCORE consortium. We're there because of time and kind, and because we believe in, you know, helping the sector to move forward and progress. So training is probably the biggest, because I think the barrier for many service leads and practitioners is time, money, and also not having the knowledge of how to maybe orchestrate routine outcome measures, because obviously you have to have a system that costs money, you have to train the practitioners to use the measures effectively. And then you have to learn how to, or get the person that sources your system to pull the data and share it with SCORE or any other consortium that could analyse it, and, you know, then report back on it.
Okay, so that sounds like something quite tangible and concrete to keep an eye out for then. And all of this information and any outputs or any training is all available on the SCORE website?
The training is being developed currently. We're waiting for funding from the Charlie Waller Trust, and, you know, various other projects are coming. I mean, you can join the SCORE project, you can share your data if you already have pooled data and a system in place. We would encourage that wholeheartedly from any service. And to collaborate with anyone else who's doing a similar thing to SCORE as well, because we don't want to just, you know, be a silo. We want to work together, because the more data we have, the more of a picture that we can generate. And, you know, one only has to look across the sea at America and look at the Centre for Collegiate Mental Health, who have been doing this for, I think it's over 20 years. They have 550 counselling centres, which are their version of University College and Mental Health counselling services, and they all pool their data. I mean, the difference is the university pays for them to do that. It's a paid process, and they all buy in. Obviously, with SCORE, we don't have the buy-in from universities. It's different in the UK, because universities have traditionally operated as individual institutions, and I guess the SCORE initiative really is to bring us together as a sector, which is difficult because people have different resources. Leadership can change, different skills are there for some and not for others. So it's not as straightforward as it could be. But I think the University Mental Health Charter and its requirement of an evidence-based practice is going to really help us move forward, because university counselling and mental health services are going to have to meet that requirement if they want to get chartership.
And it sounds like certainly in the meantime, the SCORE consortium is a friendly, safe, open consortium where people can just
We have many
join.
people around the table who don't have routine outcome measures within their services. So they're learning and being with us, with those that have. All of us who have had a journey. No one's just arrived at this. There are no experts. We're so lucky to have yourself and Professor Michael Barkham helping us make sense of the data when it comes, and also to be supported, as I said, by the professional bodies who again endorse evidence-based practice and practice-based evidence, which, you know, is essentially what would be going on in terms of the data extracted from university counselling mental health services.